We call it demographic alignment.
Okay.
And we're in the process of trademarking it. But for example, when a hospital is demographically aligned, that means when their workforce matches the community that they're meant to serve, we see mortality rates go down by as much as 50% in children, 15% in adults. And so when you ask the question, like, what's the value of health equity? It's really sort of making sure that our systems is set up to best serve the people that we are committed to serving. And data can help make more informed decisions and de-risk some of those decisions.
Hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab U Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
Well, hello again. Welcome to another episode of the Better Outcomes Show. I'm your host, Rafi Salazar from Rehab U Practice Solutions. And I get it. Organizing an event is hard work. Pressure mounts, especially when you're considering speakers, consultants, or trainers. Often the success of an event, a conference, or even a strategic initiative at your corporation hinges on the quality and the impact of the speakers and the advisors you select and hire. So there's no pressure there, right? If the speaker or the consultant or the trainer you hire, they hit a home run, then you've got yourself a great event or an initiative that takes off. But if they flop, you've got a dud. So I'm sure if you're in the ballpark or you're figuring out putting together a conference, maybe it's a continuing ed conference or a corporate event or something like that, I'm sure you're spending tons of time, hours even, researching speakers and available consultants to make sure you have the right fit for your event and your audience. If that's you and you're looking for maybe a presentation, a workshop, etc., on healthcare positioning strategy, or my personal favorite and passion, humanizing the healthcare experience, then check out speaking.rafisalazar.com. My goal whenever I do a presentation, a training topic, a workshop, is to provide you and, more importantly, your audience with the relevant, actionable information and insights that contains the tools that they need, tools and knowledge they need to move the needle on whatever the identified goal is. Maybe it's an initiative at a healthcare organization. Maybe it's just simply providing insights around practical tactics and strategies that clinicians and healthcare organizations can make within their own process of care to humanize the healthcare experience. Or maybe it's something as simple as trying to align values and incentives to drive all the metrics of the business. Maybe it's revenue, maybe it's patient engagement, retention, all of that kind of stuff. If you want to learn more, again, about that, how we can help, hiring me to speak, come to your organization, you can check out speaking.rafisalazar.com. Okay, this week we are diving into the world of data and healthcare data, specifically around healthcare data specifically in the area of health equity. Now, I know when you say health equity, there's a lot of people can feel one way or the other about it. Maybe it's a political thing or a regulatory thing. Really, ultimately, and we've had a couple of guests on the show before. We'll link to some of those past notes about like the social determinants of health and how there are connections in the literature for factors that are totally not related to physiology that result in real population health effects, whether they be positive or negative. For example, I know my former colleague Josie Baker was on the podcast from Soda Health maybe a couple years ago now, and she was talking about if you look at the data for health outcomes and mortality rates, one of the biggest factors that determines mortality rate is something like zip code or something like that, which would kind of point you in the direction of knowing or thinking and exploring, like, okay, how is like where we're living, the area, the context, the neighborhoods, the socioeconomic status or viability of an area linked to health outcomes? Well, it could be things like access to care, could be things to the quality of the care. It could be maybe financial constraints that prevent patients from receiving or being able to acquire the care they need. Or maybe it's something around culture and demographics and views around healthcare. Maybe this zip code has a lot of people from a certain ethnicity or cultural background that are very distrustful of Western medicine or something like that. That's something that's totally off the radar. You're not going to pick that up in a health questionnaire or something like that, but it can have a real impact on population health as a whole. So anyways, my guest this week is Perfecto Sanchez. He is the co-founder and the chief growth officer over at EquityQuotient, and basically what they've done is created, he calls it a dynamic denominator, but it's a way to integrate all kinds of various, often disparate sources of data, healthcare data and population data, and through technology, artificial intelligence, and the like, help healthcare organizations and systems make informed decisions to improve the health of the population that they're serving, the geographic population they're serving. So we talk a little bit about the basis of health equity. What is health equity? How does data inform health equity? We talk a little bit about EquityQuotient and how they've gone about calculating and putting the tech pieces in place, and all of that around helping American populations become healthier. So, side note, one of the glitches that we experienced, we transitioned over to a new platform to record podcast. We got a little glitch with the Canon camera that I was using to record. So the last 2 or 3 questions of the interview, my audio is completely gone for some reason. So we got Perfecto's answers on the recording. So I basically just cut out the dead space. So if it sounds like he's kind of chopping around a little bit at the very end, my audio is out. And I thought the conversation itself was valuable enough that I wanted to find a way to make it work, even though my meager contributions to it were missing at the end. So hopefully that doesn't put you off some. I'll link to EquityQuotient in the show notes. And if you want to learn more about that and kind of read up about them, connect with Perfecto, you can go to rehabupracticesolutions.com, click on the podcast, and there's the link for this episode will have all of that. Or you can go to the Better Outcomes new home, Strata Studios. So stratapt.com, I think, is the link. But Strata Studios, you'll find us there. Links to all of that as well. So without further ado, here's Perfecto Sanchez talking about health equity, humanizing the data, and using that data to make our populations more healthy.
I'm doing well. Thank you so much for having me.
Yeah, I'm excited to dive deep into the whole idea of data management in healthcare and analysis and all that. But before we do that, tell us a little bit about yourself, your background, and what brought you to what you're doing now with EquityQuotient.
Yeah, totally. And what's interesting is almost nothing in my background would be considered native to healthcare, or at least the industry. But of course, we all experience the healthcare system in some form or another. And my background, I would say, is somewhat unconventional, but it's all about my why. And so I'm born and raised in New York. I was born in Harlem. I was a product of New York City public school education, I like to say, K through college. And education really changed my life, and that's really what got me on my path of becoming an entrepreneur. And so I went to West Point, the military academy, and I'll age myself a bit. I went pre 9/11. So never in a million years did I think that we being the country, would serve in a 17-year-long war. But it was a great opportunity for me to sort of change my trajectory, get out of Section 8 housing, and to get a world-class education. And 9/11 happened my freshman year. So I graduated, I did 2 tours overseas as an infantry officer. So was deployed to Iraq, spent over 20 months in combat. And it was, first and foremost, a privilege to lead soldiers, which is a responsibility I take, I hold very near and dear to my heart. But it's also really catalyzed my commitment to purpose, to impact, and to service. And there's something we learn in Ranger School that we ask ourselves: where do we need to be on the battlefield to make the biggest impact as a leader? And I've kind of maintained that question that has throughout every endeavor since in my professional career. So I got out, did a couple years in marketing at Kraft Foods, and I literally said, in the interview, I said, if I can sell democracy, I can sell powdered soft drinks, and I really want this job, even though I've never taken a marketing class a day in my life. But that sort of started my career, and from working at big companies to eventually starting my own agency. So my agency, which you run a very successful agency, so I'd love to hear more about sort of your experience in the service-based business. But our thesis was we want to elevate purpose as a way to drive growth. And we were selling to cities, to foundations, to funds, also to big brands. But when you're in the world of impact, what's missing is just data. Like, how do you measure it? How do you know if it's working or not? And the truth is that there's tons of data, but it's often very expensive and complicated. And so my incredible business partner, Christina Van Houten, and I met over 3 years ago. She spent 3 decades in enterprise tech. I have a background in sort of storytelling and marketing and brand building. And we started to build EquityQuotient, which is, in a very simple explanation, a dynamic denominator for what's happening in our communities. So we pulled different data sets to allow organizations to better understand the communities they operate in.
Yeah. Man, that is a roundabout way to get into what you're doing now. Thank you for your service. That's awesome.
For sure.
I guess, backing up a little bit, so obviously EquityQuotient is taking a lot of this disparate data and it's using it with the end goal of expanding health equity. So I guess tell me a little bit about, for people that haven't heard, what is the push for health equity? What do we mean by health equity? And kind of what are some of the big challenges in leveraging data to improve it?
Great question. And whenever I talk about something such as health equity, I like to try to take a step back to really just sort of paint a picture where everyone can just really understand the sort of dynamics that are at play here. The truth is with healthcare that most of the determinants that affect and impact someone's health occur outside the 4 walls of the hospital. Yeah. Some say it's as much as 80%. And so this really is dependent on where you live, how much money you make, sort of the water that you're drinking, the food that you're eating. And these are factors that the hospital doesn't necessarily impact. Yet the hospital, in the current state of the system, is responsible for ensuring that they're serving everyone in the population equitably. But without really understanding what's happening or what the factors are, you're kind of flying blind. And again, not to tie everything back to my military service, but we call this sort of market intelligence. We knew a lot about the areas we were going into before we went into them. And so the goal and the objective and the value of EquityQuotient is that we can help hospitals, providers, and even payers in many instances just have more accurate, dynamic data on what's happening in the community. And this is a multitude of factors that are not necessarily, quote unquote, traditional to healthcare, such as pay equity, home ownership, access to education. And we see correlations to these sort of insights that actually can help impact outcomes. And so we actually trademarked a term to try to get away from the word health equity a little bit, but we call it demographic alignment. Okay. And we're in the process of trademarking it. But for example, when a hospital is demographically aligned, that means when their workforce matches the community that they're meant to serve, we see mortality rates go down by as much as 50% in children, 15% in adults. And so when you ask the question, what's the value of health equity? It's really sort of making sure that our systems is set up to best serve the people that we are committed to serving. And data can help make more informed decisions and de-risk some of those decisions. And there's a compliance aspect to it too, which I'm happy to go deeper into.
Yeah, no, I mean, I think you bring up some some already very interesting points. Like we've had somebody on the show before talking about social determinants of health, and her big point was, like it shouldn't be this way, but it is. That oftentimes physical health even isn't the arbiter of, or the most telling thing of your health outcomes. It's like zip code, like where you live
100%.
impacts everything from the care that you have access to, from the people maybe even the resources for like nutrition that you have access to, like, so that it's a very tough thing to solve. And like you said, hospital systems are kind of mandated or tasked with like serving the immediate or the local geographical setting where they're at. And it seems like a very difficult nut to crack, because like you said, there are some things that are just entirely out of the hospital system's control, right? Like the average income or something like that. So maybe we'll dive into compliance in a little bit, but how does, give me an example of maybe how having some of that dynamic data at the forefront or at the ready helps a hospital system kind of improve population health in their local geography.
Yeah, great question. And I'll actually try and do both, bring in the compliance aspect and the action piece of it. We've already talked about workforce, right? Like if a hospital recognizes that their population health is evolving, they can address their workforce to hire to best meet the needs, the cultural needs of a community. Yeah. And that's been well documented, right? Like, there's a cultural dimension of how people listen and receive health and even pay for health care. But let's start with the compliance piece. And so nonprofit hospitals are mandated by the IRS to fill out a community health needs assessment every couple of years to maintain their 501(r)(3) status, which makes sense, right? The government's like, hey, we're giving you a huge tax break. We want to know how you're serving our residents and our citizens.
Yeah, you need to be providing some kind of public benefit, right?
Totally. It makes, again, like, let's just, keep it simple for now, right? And so the hospital's like, okay, great, let's do a couple of surveys. And right now the way they do it is mostly manually. So they sometimes partner with local universities to say, hey, take your students, go out and survey the population. We want to understand what the needs of our community is. And even looking at census data. And then you can look at some insights around there. But with EquityQuotient, we're pulling in a wide swath of data and dozens of data sources. A lot of .gov, but we're doing a lot of private and third-party data sets, such as Zillow and some credit bureau data as well. And so we can get more accurate data and more dynamic data. And we're pulling certain things like even crime data. And so if there is an increase in crime, which an FBI statistics will tell you, and some of the local police data will tell you, the hospital is more likely, to sort of see an increase in sort of crime-related injuries, traumatic injuries, totally. And so this is, instead of the hospital flying blind or, again, being reactive, the community health needs assessment is meant to do that, but EquityQuotient can sort of pull in a more dynamic dimension around that. And what we're seeing that, again, are the factors that are not controlled within the four walls are increases in opioid use, increases of obesity, increases of hypertension, which can be a really direct result of changes in the economy, or like increases in unemployment, which is going to, cause like sometimes a direct correlation to increase in substance abuse. And we're even pulling air quality and water quality. And so this is how data can help inform decisions. And then from a hospital perspective, they can look at either one, we are equipped to meet this need, or two, it might be worth, instead of spending increased money internally, to collaborate with a community-based organization that's potentially better suited to meet the population where they are. And that's a sort of macro trend that you're seeing in healthcare as a whole. It's like, how do we evolve as a society, as a system, to have more tools at our tool belt? And so we have an increased aging population, so aging in place. That's something that, again, a hospital may not be sort of natively equipped to do, but many community-based organizations may be. And so there's an economic incentive to make decisions based off how it can improve outcomes more efficiently. And the data is one piece of it, but the other side of EquityQuotient is that we can actually track progress over time. Yeah. So it's valuable just to say, okay, what's happening outside our four walls? And then it's good to say, okay, here's where we are today. This is just a reality. Let's benchmark based off of some objective number. And then if we are changing our investments or making more investments, let's see if it's working. And if it's not, let's adjust. And so you see this in almost every single industry, and we're trying to help the healthcare industry potentially move forward by leveraging some new tools.
Yeah. Well, and I guess talk a little bit about the challenges of that, because I mean, you were talking about Zillow and FBI.gov, and like it seems like as a layperson that's not into the tech side of things that you're talking about big systems with a ton of data. I mean, I'm sure FBI.gov has like terabytes of data somewhere on a server, and then you're trying to make those jive to give maybe some kind of analytical or visual analytics so the healthcare system can make decisions. So I guess talk to me a little bit about that, some of the challenges in taking kind of these disparate and often siloed data sets or big warehouses of data and making something useful out of it, because that just seems like you're talking a lot of time, a lot of effort, a lot of money, a lot of manpower to do that.
I mean, you hit the nail right in the head. What we did is hard. and I mean, I'm very fortunate to surround myself with much smarter people than me, and we have an incredible team of data engineers and scientists. And again, my business partner has a rich history in tackling some of these very issues. And so our first order was to integrate these disparate data sets that have not traditionally been integrated before in the past, which again is why a lot of organizations, even the biggest ones, haven't done this themselves or do have huge teams to try and do it, which just makes it more expensive for one organization to do it on their own. And so the value of EquityQuotient is the fact that we've invested years and millions of dollars to do it. It can effectively be more accessible and more cost effective for us to share these costs across multiple customers. So they don't have to do multi-million-dollar investments. And what we've delivered is what we call, again, a dynamic denominator. And so we are able to then know at least where we're starting from. And we're committed to always growing. So we're always integrating new data sets as we partner with a lot of nonprofits who are experts in particular areas. For example, we have a partnership with Jobs for the Future, who's committed to investing and working in representing returning citizens or returning residents, those who have been impacted by the justice system. And even though this is captured in the Bureau of Labor Statistics, we know that this data is not always accurate. And with the advancements of AI, sort of like part of our why is we want to champion what we call inclusive AI. Because as AI continues to move forward, like, let's be honest, it's just here to stay. Yeah. If we don't have data representative of all communities that have not been historically well represented, we're not going to get the best insights or the best recommendations on how to equitably move forward. And so that's really, as a tech company, this is our superpower, and where we can come in to provide a very valuable insight. And we love collaboration, so we are working with experts in healthcare on the consulting side who can use our platform to make more informed decisions. And at the end of the day, we just love what we do. I feel very grateful to wake up every day to work in this dimension.
Yeah, you bring up the point about AI. We just had somebody on the show, and they were talking about like even the data that's being used to train these algorithms. Like if you're using like a homogeneous population and then you're trying to apply it to somebody else, or maybe it's a bunch of data from like a bunch of females or a bunch of males, and you're trying to take that and apply that to another group, like the artificial intelligence or the algorithm or whatever you're using, whatever software is built or prediction model is built on that data, can inherently be flawed based simply off of the population that it was used to be developed, right?
Totally. I mean, something I think this is universally known now, but look at oximeters in COVID, right? They were validated by the FDA, tested 1 million times, but on a homogeneous population. And it's been now known and well documented, or at least revealed, that oximeters do not accurately capture oxygen levels with people with melanin. And so when you look at why people of color were dying or being misdiagnosed at such a higher rate during COVID, when oximeters were deemed as the primary tool to triage people, again, like the data was not representative of everyone. And so you play the movie out and you start looking at these large LLMs, these large language models and use cases of an AI. Again, AI isn't biased. Like, our history is biased, and our society has been biased. And so we don't have these data sets. And so the other side of EquityQuotient is our commitment to make sure that, one, we're auditing ourselves, but two, really expanding the data sets to be most representative of our society, so that, again, healthcare leaders and organizations can make more informed decisions and more accurate decisions to improve population health. And we're starting with compliance because at the end of the day, like I should have mentioned this, hospitals are currently doing this because they're mandated to.
Yeah.
And they're spending millions of dollars doing this manually. And so we can do this much more cost effectively and more time efficiently. And so we can immediately save hospitals money, millions of dollars. And we were recently chatting with the chief medical officer of Microsoft, and his estimate is that we can take out 25 to 33% of costs, of administrative costs, out of the system. And so EquityQuotient is really committed to, again, helping to improve outcomes more cost effectively and leveraging data to do so. And it's something that we just need to do because we're at such a watershed moment in the industry. Now, I was just going to sort of share a fact that, probably almost everyone knows that listens to your podcast, which I love, by the way. As a country, we spend 18% of our GDP on healthcare, and we have like the worst outcomes of the top 25 developed nations. And so and you can see leadership starting to make changes with CMS changing reimbursement rates. And so it's a really exciting time to understand how we can work smarter, not harder, to improve outcomes. The one takeaway I would be is just do something kind today. It might sound cheesy, but I just think that, if you're listening to this, you're obviously someone who's curious, that wants to learn and to be better. And I think each one of us can always just be a little bit better. But selfishly, follow EquityQuotient on LinkedIn to stay tuned for some of the updates that we're doing. And even sign up for a free account on our website, EquityQuotient.io, and you can learn more. And we believe we are part of a village, so we'll hear from your listeners to see how we can be better. Appreciate it, brother. Thanks for the time.
I hope you enjoyed that conversation with Perfecto Sanchez around health equity, using data to improve population health and empower healthcare systems and decision makers to really make decisions that are going to be effective, right? I think ultimately when we think about health equity and just making decisions in big healthcare systems that are going to, oftentimes these decisions have impacts basically on everybody that receives care at that healthcare system. You want to make sure that you're doing it and you're going about making the decision in a way that is the most informed. And oftentimes, I've been in this situation before when I was at the VA and we were doing some strategic planning when I was part of that executive leadership development program. And we were looking at data from 2, 3, 4 years ago, sometimes, that we were making policy changes for the hospital and for the way that care was going to be received, some of the care pathways, based off of this data that was 4 years old. Simply because that's just how long it took the decision-making process to get to. They did the study, they gathered the information and the data, they analyzed it, they put it on a committee. That committee put together a proposed rule. That rule floated, or the proposed policy. That policy went through the various departments for input and approval and all of that. And by the time it got down to, okay, are we going to enact it? What does it look like? Let's implement it. The data is already 4 or 5 years old. So the ability to be able to do and to have accurate data that's as current as possible, that's analyzed in a way that is going to be truly representative of the stakeholders or the healthcare partners or decision makers or receivers of care that you're going to be affecting with this decision. can be super, super valuable, save you a lot of time, energy, and money on failed initiatives, or even policies that are like a year too late or 6 months too late, right? Again, this topic comes up over and over again when we are discussing artificial intelligence and using, whatever kind of tool or software is going to be used to analyze the data to make decisions, healthcare decisions or policy decisions, is the importance of where that data comes from and making sure that that data, by the nature of its source, does not or is not generalizable to the population on which it's being applied. For example, I was talking to somebody the other day who was doing artificial intelligence, and I want to say their company did something. It was a kind of imaging study analysis, like a precursor screening. It would look through like cardiac, I believe it was echocardiograms or something like that. It would look at the data, make a flag for the clinician that was reading the study to say, okay, pay attention here, pay attention there. And the founder was talking about how one of the biggest things they had to overcome, one of the biggest things they wanted to get right out of the gate, was making sure that the data that they used to train the AI was representative of the intended population. Because what you end up having, and a lot of these companies will get big storehouses of data, they'll get big databases, and it's all available data from past patients, which is wonderful. But if you dig into the data and get a little granular, you'll see a lot of that data is skewed one way or the other, either towards a specific demographic, maybe a specific gender, maybe a specific ethnicity. And for something like cardiac issues, where there can be a lot of genetic variability between various cultures and geographic locations even, sometimes there are cardiac adaptations in one part of the world we don't see in another part of the world. And the founder was talking about how this was a big challenge to overcome, because if the data is not as whole and comprehensive as it can be, sometimes it will flag things that are not really a problem given the geographic location or the ethnicity of the patient that's being screened. And sometimes it will miss things that could potentially be big issues in the same situation. So it's interesting to me how no matter what kind of topic we're discussing when it comes around artificial intelligence and technology and implementing it in the healthcare environment, specifically for healthcare policy or clinical decision making, the importance of the data really, really, really has become I'm much more cognizant of it now. We did a podcast episode a while back. I think we called it like healthcare data is the new oil. And what I was talking about specifically in that episode was kind of some of the business aspects of it, but then some of the clinical applications. And I think that has become, maybe this is not news to people that are in the know and building these tools. I'm coming from this as like, I'm a clinician, and now I do some positioning and go-to-market strategy for organizations in the healthcare technology space. So like training AIs, coding, none of that stuff is in my wheelhouse at all. I just bring, a decades plus of understanding of the healthcare space to my engagements. So it's becoming more, it's a new thing, it's interesting, and it's becoming more of something that I'm aware of whenever I'm talking with a founder or talking with maybe even a prospective guest for the podcast about their tool, about their software, about the way their technology or artificial intelligence is going to shape XYZ part of the industry, specialty or something like that. That the data really is important, and more than just in the initial training of the AI, but making sure that data is generalizable across populations and geographic regions, and for the accuracy, the long-term accuracy and viability of that solution. So anyways, those are just my little thoughts on it. So if you like the show, head on over to iTunes, leave us a rating and review. Helps people find the show, or just share this episode or one of the other 130 episodes that we've got in the backlog with a friend or colleague who you think might benefit from it. And if you run a healthcare organization, maybe it's a healthcare clinic, maybe it's a healthcare system, or maybe it's a healthcare technology company, and you want to differentiate your healthcare service or solution from your competitors, If you want to align your solution or your service with your targeted healthcare buyer, and you want to create a consistent message to drive business in the form of qualified leads and ultimately sales for your organization, then check out the Healthcare Positioning Alignment Workshop, where we help you develop an effective, succinct, and unique positioning strategy for your healthcare business. Obviously, healthcare is complicated, and it can be very difficult to understand, like, how do I get the right buyer to the table? Well, it all starts with answering the question, value to whom? Different healthcare stakeholders and buyers have different things that they consider valuable, right? They're looking, it might be the same tool, but two different healthcare buyers are going to consider different things more of a value add or more of an insignificant feature. So by narrowing down the value to whom question, you have a clear idea of how your solution, your software, your service is positioned to solve the problems faced by that specific buyer. So if you want to learn more about how we can help you develop that effective value proposition, set up your system so that you're driving qualified leads into your organization, then check out the Positioning Alignment Workshop. You can find that at positioning.rehabupracticesolutions.com. That's positioning.rehabupracticesolutions.com. Okay, until the next time, be safe, be healthy. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehabupracticesolutions.com. We'll catch you on the next episode.